got snow or dreekness as we have in London and the southeast, and lots of that makes me slightly trepidatious about the fact that I'm going to have to leave my house and catch the train into London after this. But anyway, you are very welcome, whatever the weather. Just to say, because this is such a big event and we have so many people, I know that the chat is always really, really vibrant, and we will use it. But we do have 2 delegates today who are deaf, so we are going to make sure that they have full access to the chat after the event, because obviously difficult to both read what's going on in the plenary and keep up with the chat. But you will be advised if you're in a workshop and one of our deaf delegates is with you, you will be advised that we'll be asking people not to use the chat in the workshops, just so that they can have the sort of full interactive same experience as everybody else. So having said that, I'm now going to ask you all if you could all introduce yourselves in the chat. Just say who you are and where you're from, just so that everybody can get a sense of who's here, and say hello to old friends. Rain in North Somerset. So, and snowing in Sheffield. Oh, not settling though, Alistair says. So, and I'm glad that Alistair's here, because he's one of my speakers as well. Okay, so the things that I have to tell you. So yeah, good morning. We are really delighted. This feels like a really good moment to be updating you on the SEND and AP systems improvement work. So we've got Alistair here this morning from the Department for Education, who's been leading on the work of the implementation team at the DFE. So he's going to be sharing with you where the change programme partners are up to in their change journey. And we have got then Ofsted and CQC talking to you about learning from inspections. And we have got a very full NHS England house this morning. So Lorraine and Rachel, who you've heard chatting earlier on, and Sally, who are going to be talking to you about some of the work that they've been doing. So obviously, we're always really pleased to hear from Lorraine, but asked her to provide some detail this time on the amazing work they've been doing. So that's great. And then obviously the SEND and AP improvement plan marked a change for us really in the world of SEND by extending our acronym to SENDAP. So really good to have Adam and Mark from Olive Academies talking through the emerging roles of AP alternative provision in local SEND partnerships. So I think we've got a really great lineup and some really, really good workshops. So I hope that you really enjoy the day. So you have been reminded on the slide, but just to remind you, if you could keep your cameras off and your mics on mute, unless of course you are one of the speakers, in which case that would be unfortunate and unhelpful. Just to let you know that this event is part of the RISE programme. So that's a contract that we have with DFE in partnership with the National Development Team for Inclusion and the Warwick University and ISOS partnership. So, and this slide here, I take it we haven't got Sam G with us. Macy Ray? She's smiling at me. But anyway, I am competent enough to talk through the slide, so we don't have to summon him up from, he was in his sick bed yesterday. So yes. So hopefully, as you're aware, part of what we deliver through the RISE programme is the What Works in SEND programme, but we also have targeted support that's on offer to local areas, and as well as events like this and some of the webinars that I know that some of you will have been to. So some of the sort of popular support that's available through RISE is listed there, so I won't read it out, but it is very much a bespoke programme. So if you and your DFE case lead or the SEND advisor feel that actually there's an area of development or something that you're struggling with locally, and it might be helpful to get sort of external input and facilitation around moving forward with that, we can absolutely look at working on that with you. So, and the process for that is on the right hand side. So discussing that concern with your case lead, and then having a scoping call. If for any reason you don't know who your DFE case lead is, then do let us know, and we can do we can do the process the other way around. We can put you in touch with your case lead and come back to it like that. So and I think Macy Ray put up the workshop times then, and also just do not worry if you don't have a workshop and you wanted one. Just email Adiba, whose email is at the bottom of that slide there, and let her know. And if you've chosen one but you don't have the link to it, just let her know which one you chose and she'll send you the link. And if you didn't choose one, then hopefully, has everybody got details of the workshops, Macy Ray? Just put your thumb up.
Yeah, everyone should have them.
Fine. So yeah, so if you, brilliant. Okay, everybody's got marvelous, loads of thumbs. So yes, and we're also really delighted. So at our last national event, it was the last one that Christine Lenahan chaired, and so we gave you the opportunity to say goodbye to her, but you can also say hello to her again, because Christine's back from her little round the world trip, and working for us as a strategic advisor, and doing specific project work, and is really kindly, one of the things she's doing a fair bit of is chairing improvement boards, which no doubt you will it may be touched on in the Ofsted and CQC presentation, but if local areas do get a poor inspection, then one of the requirements is to set up an improvement board, and Christine chairs 3 of those improvement boards, so her workshop is about that. So really pleased to have Christine with us today. And we've got some great workshops, and one of the really lovely things about these events is we are really aware how hard it is at the moment in many local areas, just to do the day job, and that there are lots of things that are making that a real challenge. So it just feels really, really important, and I think the workshops are one of the best ways in which we do that, to bring those people who've had who've thought of an innovative way of doing something that makes things slightly easier, something that makes delivery work better or more effectively, and getting them along to share that learning with you. So some really great workshops this morning. So I think that's all I needed to say. I'm just going to check my notes, because otherwise Macy Ray will frown at me. Oh, I have got more to say. So our next national webinar is called From Data to Intelligence, and that's on the 5th of March online, and it's now open for registrations. So Thea is going to post details of that in the chat. So if you haven't signed up for that and you think it might be interesting, then do let me know. And before we move on to Alistair and the update from the DFE, we have, we like a poll. We've got a poll for you. So the instructions are there in terms of accessing it from your smartphone, or your laptop if you haven't got a smartphone. So our first question for you is: I feel well informed on the current SEND landscape. And Macy Ray will be monitoring the floods of replies on the Menti poll.
Sure, I'll just leave the slide up for a minute and then I can share the results for everyone to see.
Brilliant. And I think that's a really interesting question. we've probably shared this with you before, but we really like at CDC. Somebody described to us SEND as being the most systemy system that there is. So to feel well informed on the current SEND landscape means you are holding a lot of information in your head.
I'll take this down now, and I'll share the results in just a second.
Brilliant. Thanks, Macy.
Yeah, so these are where we're up to at the moment. So it looks like a lot of people have been able to vote.
Brilliant. So somewhat. I love somewhat. A bit.
Cool. I'll take that down and go back to the slides.
Brilliant. Thank you, Macy. Okay. Right then. So is that everything that I had to do, Macy Ray? Have I forgotten anything?
No, that was great. Thank you.
Okay, so brilliant. Well, that does bring me then onto our first speaker. And I'm sure Alistair will say something about this. We were hoping that Fiona and Guzo would be able to join Alistair, but unfortunately she's had to have an IOP, so she's not with us this week. But those of you who have heard Alistair speak before knows that he doesn't need a sidekick, not even his boss, and he's a great speaker and more than capable of engaging you with an update on the change programme. So Alistair, I know you're there. Over to you.
Thank you, Amanda. Yeah, I think you might have set me up there, but very, very kind words. Thank you very much. Morning, everybody. I've just been keeping an eye on the chat, and there's a few familiar names in there. People have heard me speak before, but also some new names. So I'm sort of pitching this a little bit. Some of you might not know all the background. Some of you will know more than others. So I apologise in advance for things that you've heard before. But hopefully, as I get to the back end of what I've got to say, we'll be into some stuff that's new for everybody, and really hopefully trigger some questions as well. I'll try and get through this to leave some time for a few questions, I think, if that's possible to manage with so many people in the room, which is great to see everybody. So I'm going to do a bit of a reminder, bit of a progress update, give you some sort of insights into our early insights, what we're beginning to learn from the change programme already, and then a little bit of a heads up about what's sort of coming next. And as Amanda said, Fiona was due to join me, but she's still recovering from an eye operation, so unfortunately she's not back at work this week. I won't go into the details. She did tell us, and it's all a bit gross and gruesome, as these things often are, so it's a bit too early in the morning to get into that sort of stuff. So just as a reminder, context, next slide please, Macy. The change programme is part of, if you like, 3 bits of action that have come out from the SEND and AP improvement plan. So a big chunk of what we're trying to do is support and stabilise the system, and that's ongoing now and will be familiar to many of you. So we're looking at things like the Delivering Better Value programme, the Safety Valve programme, that are aimed at helping those local areas that are struggling financially to make the system work. You've got universal SEND services, you've got the work of the SEND improvement and the RIAs, the regional improvement and innovation areas. All of that stuff is in that mix, in that first block, and that's going on now in the background, as is our work to increase supply, and that's both supply of specialist places, so more new free schools, special free schools announced. There should be some more new AP free schools being announced shortly. Obviously they take a while to come through, because from the point of actually announcing that we're going to build one, you then got to buy the land and build one, and it takes time. So appreciate that some of that's not going to materialize in actual places in your areas for some time to come, because we've got to get through the process, but that is in train. We're also looking at expanding the number of education psychologists are out there, but again, that's a 3-year training program, so it's going to take some time for us to see the benefit of that piece of work to increase the supply of education psychologists. And then things like supported internships. We've increased the funding for supported internships so that we can do more of those. And we're also piloting a slightly different variation on supported internships for those young people without education, health and care plans, to sort of bridge the gap, if you like, between apprenticeships and supported internships for those with education, health and care plans. So there's lots going on already, into which the change programme, the design and test element of what we're doing from the improvement plan, sort of fits into that landscape. So we're not putting all our eggs in the change programme basket. There's lots of other stuff going on. But what I'm going to talk you through now is really sort of where the change programme's at and some of those things that we're learning from the bigger set of reforms that we set out in the improvement plan. So next slide, just as a reminder, this is where we're testing. So there are 32 local authorities working with their partners in education, in health, and with their parent groups and children and young people's groups, amongst others, grouped into 9 regional change programme partnerships. And you can see those on the map there. They've been well publicised. You're probably very familiar with these by now if you've been keeping track of what's going on. And we are working very closely with those of the departments. So my teams are out and about, very much a boots on the ground approach. So actually being out there, physically being out there and working with those areas, providing a bit of support and challenge, alongside our external delivery partner Reach, that is a consortium headed up by PA Consulting, of which CDC are also a part, as are Olive Academy, who you're going to be hearing from in some of the workshops later on, to really provide that system change expertise, but also some of that subject matter expertise to those local areas to help them get to grips with and start to test and help us learn whether these reforms are actually going to work or not. Again, most of this is probably familiar because I've spoken here before and we've used this slide before, so that's just by way of reminder. On the next slide, we're getting into, this is what we're testing. And again, I'm not going to unpack this in detail because many of you will have seen this slide before, but just as a brief reminder, how we're sort of envisaging this, if you like, is on the left-hand side, you have a bunch of things that we're calling enablers. So the things that make the system structure work. So partnerships, plans, understanding the data and the data dashboard we're using. In the middle, you've got a whole bunch of stuff that's all around early identification and intervention. Can we actually make sure we're spotting needs much, much sooner and actioning those needs very, very quickly? In many cases, enabling us to reduce the need for people to pursue an EHC plan because we're meeting their needs at the earliest opportunity. And then on the right hand side, you've got the sort of things that are relate to that EHC plan process, multi-agency panels, testing a new template, those sort of things in there. And all of that will feed into, over time, the development of national standards and how we might want to do commissioning of services. So that's just again, very brief touching on the reforms. But in terms of where we're at with these things, so just dwelling on this side a little bit, all of the change programme partnerships have now submitted to us a strategic delivery plan, which we've seen. So they've said, this is how we're going to work together, this is how we're going to use the money, this is how we're going to approach testing the reforms. All of them are working on putting together their SEND and AP local partnerships. All of them have at least a core of that in place, and are still, some of them are still refining that, working out exactly how you get the balance of getting all the right people on there without it turning into a huge committee that doesn't actually get anything done. One of the challenges, for example, is how do you involve parent groups in the right way so you get a good representative voice in that partnership from local parents? How do you do that for schools? Schools are divided up into lots of multi-academy trusts, maintained schools, independent sector. How do you, in a partnership context, get 1 or 2 voices in the room that can represent such a broad system and such all the different players that are in that system? So those are some of the challenges being faced there, but they're working on those, and all of them, those partnerships, are in the process of putting together the local area inclusion plans. And yesterday we had the first couple of those in from a couple of areas, so we will start to look at those and get a real sense whether those plans are really doing the thing that we want them to do, which is not to be strategic, sort of big sounding phrases and big sounding ambition, but actually to be actionable plans, things that you can actually see are going to be the steps that an area is taking to make that tangible change that we need to see for children and families. So we'll be looking at those over the coming weeks and just getting a feel for whether what we're asking for and the guidance we've pushed out already is actually going to drive the change we want to see. Lots of areas are, well, all the areas now are recruiting towards the early language support for every child pilot. So in each of those 9 change programme partnerships, at least one local authority is testing this pilot that is all about providing rapid support in early years in primary to children who are beginning to deviate from age-related expectations in terms of where they should be on speech, language and communication. And again, it's a bit like a rapid response service. How do we get in there quickly, use the toolbox of things that we know work to help people improve their speech, language and communication, and actually just get on with doing that rather than waiting for some sort of diagnosis or assessment before you do anything. It doesn't mean there won't be a diagnosis or assessment happening for those that need it, but it's let's just start doing something and helping these children, possibly while we are waiting for that diagnosis, because we know a huge chunk of things that work for those children. So that's in place. They're recruiting the professionals for that to come and help work on that. And then areas are beginning to start looking at what does that AP service look like? So how do they structure and build that so they can start delivering that, and particularly the outreach service that's going to reach that support back into mainstream school again as part of early intervention. Let's tackle those needs and emerging issues early so that we don't necessarily need to see children being excluded from school, because actually we're able to help them, support them and enable them to stay where they are in mainstream, where that's the right thing for them. And then most of the CPPs now, the change programme partnerships, have at least one of their areas is now live testing the education, health and care plan template, and those numbers will just grow from here on in. So that's good progress too. So we're starting to actually get into, away from just talking about setting this up and all the setup happening, to actually starting to test some of those reforms, which means we can then start to learn from them. So that's sort of where we are in the reforms. In terms of what we're beginning to learn already, there's been some early insights, and on the next slide I've just summarised a few of those, because it's been quite tricky. If Macy's good, there we go, moved on. It won't surprise anybody on this call to know that one of the biggest things that we've confirmed, I think, which we all knew anyway, but it's really helpful to be able to actually build the evidence and show that this is the case, particularly to people that are asking us questions like Treasury about how all this is going, that actually capacity and capability constraints in local areas are a huge challenge. And you all know this, there's a whole bunch of reasons why that's the case. I haven't got time to dive into all of that here. But even with the support and the funding that we're providing, even the best local areas are struggling with some of this. It's just difficult. It's a complex system. There are so many moving parts, and as you'll see on one of the boxes here, the other aspect of it is there's so much other stuff going on as well. So the success of what we're doing is dependent on those other system conditions that are in place. So what's going on with children's social care, all the big changes that are happening there, what's happening, changes in integrated care boards and the health reforms and the changes that are happening there, the changes that are happening across the school system, etc. All of those things are making this a challenging environment, not to mention we're dealing with the post-COVID impact on children, the mental health crisis we're seeing, all of that in the mix. So it's very, very challenging environment, as Amanda alluded to earlier. So we're really being able to evidence that through this, which is really, really helpful. And it gives us some questions about how you might roll out the reforms if we get to a place in the future where we say we want to do this across the whole national system. Actually, it's very clear we'd need to do it with some sort of scaffolding, some sort of support and funding to enable local areas to make the changes we want them to make. A real benefit has been those change programme partnerships. We've thrown some unusual bedfellows together in terms of local authorities who don't necessarily usually work together, and many of them have come back to us and said that's been really good, because that that cross-pollination, that understanding and learning from each other and sharing practice has been actually quite beneficial. So again, that's been a great thing, and something we're going to think about in terms of what might national rollout look like. Do you group local areas together in sub-regional groups, if you like, to say actually work together on this, because there's something about the power of doing that that is coming through in the work we're doing. It's really clear that actually the voice of local stakeholders, whether that's parents, children, young people, providers or others, is really, really important to local authorities, and that's good. And actually there's something about how we create a vision here that we can all get behind, so that we get that momentum going, because if we're not taking everybody with us, it's just going to remain contentious and difficult, and we don't want that to be the case. We want this to be a system which is a much better experience for families and children and young people. And I think the other thing is, and again, this probably isn't a surprise to anybody, is ordinarily available provision, which is one of those snappy titles the department gives to things, and it talks about it in the improvement plan, but it's basically what do we do before you get to an EHC plan? How does the system work much better in that space in terms of addressing need really, really early, identifying it, doing something about it, and actually enabling many more children and young people to do well and flourish in the system without needing to feel that the only way they can get the help that they need is through an education, health and care plan and the statutory end of the process. That's a real challenge. It's a bit of a holy grail, I think, for many people in the system. If we could get to that, it would make such a difference, but it's really, really difficult to do. So we're looking at increasingly how does that bit of the system work better, and the department as a whole is starting to have bigger conversations about what does that bit of the system look like in a future world. So it's going to be interesting to see how the evidence from the change programme starts to inform some quite big conversations that are going and just beginning at the moment. So that's where we are on insights. In terms of next steps, so on the next sort of slide, the change programme was always about building the evidence base with a view to what might we need to legislate for or fund in the future in terms of taking forward the things we've said in the improvement plan and rolling those out across the country. So that's still the aim. Obviously, there's the somewhat big unknown of an election that might be about to happen at some point this year. And obviously it's entirely up to whichever, whoever the government is after that election, it'll be entirely up to them what happens next, and where they want to go with all of this stuff. My personal view is that they will, whichever government we're working for, the SEND system still needs to be reformed and to change because it's not working, and any government coming in will see that and want to do something. And I think for me, the change programme gives a ready-made vehicle for whoever it is to be able to go, let's do some stuff and see what works. And some of it, I think, is not party political. So I think some of this stuff will just carry on anyway. Some of it might change a bit. We just don't know. Trying to predict what a new government will do is very difficult. But the intention at this point is to still carry on and aiming for building the evidence base for those things. In the shorter term, working with our delivery partner Reach, we will start to share what we're learning from the programme, and we're probably going to start doing that very much more widely from about Easter time as we build up enough of a body of evidence to actually be worth having conferences about or webinars or whatever, and beginning to share that more widely. So there's that regular learning coming through the programme that we will begin to start encouraging people to look at, to consider, and across the country to maybe be early adopters to start doing some of this stuff, because what we're seeing is that it works, and therefore why don't just get on with it. You don't need legislation to do much of the things that we're testing here. You only need legislation to enforce many of the things we're testing here, the exception being some of the stuff we're doing in the education, health and care plan space. And that's it. I'm conscious we've got about 10 minutes left for questions, so happy to throw that open. The next slide, by the way, just has on it a couple of useful links, and I'm happy for these slides to be shared. So our delivery partner Reach have now started producing a monthly newsletter. The first one is out from January. That is open to anybody and everybody to sign up to. So there's a link on those slides for both that first edition and to the sign up site as well. So if you want to keep in touch with what's going on in the change programme, feel free to sign up for that, and that should come out every month. It will have some views from people actually delivering on the ground. It will have views from parents in it from time to time. It'll have a general sort of overview of the progress we're making. So feel free to sign up to that, and that will keep you at least at a certain level informed of what's going on. And I'll stop there, and then let's throw it open for some questions.
Right, and you have got some questions in the chat, Alistair. Just before I come to the one that sort of, well, actually, no, I'll do that. So you were kind of talking about the newsletter, but there's a question from Elizabeth in the chat about how the change programme partners are going to be expected to share their learning as it happens with their region. So if you could maybe just say a bit more about that.
So in terms of with their region, we're not particularly asking them to do that, but many of them are doing that anyway. So some of my team, for example, have been asked by their change programme partners that they work with to go and speak to the regional ADCS meeting, or some regions have, like the groups of all of their MAT CEOs come together, so they're speaking to those. Some of them are using the Regional Improvement Innovation Alliance structures to share what they're learning. So it's different in different areas depending on what their relationships are like and how they want to go about doing it. We're not particularly asking them to share regionally because we will do that from Easter anyway. So when we start to share the learning from the programme, we will probably do it, for example, by working with the RIAs and saying, let's run a regional webinar and start to tell people what's going on and share what's happening. So there is a whole sort of set of steps that we want to go through to share the learning from the programme and actually do that in a way that everybody can access. So we're not pushing specifically at this stage for the change programme partnerships to have to do regional stuff, but many of them are doing so anyway.
Brilliant. Thanks, Alistair. And I can help you a bit with the next question. So is there any emerging evidence to suggest making the disco role mandatory? And just to say that through the What Works in Send programme, Warwick, that's one of the things that they're currently looking at. So they're doing some primary research, not just about the disco role, but around some key roles that are seen as pivotal to a good send system. So including the DCA or DMO as well. So and I'm just trying to remember when that started. So that should be available about June time, I would say. So we'll have that evidence. Anything, Alistair, that's come out from the CPPs in terms of that role?
Not particularly at the moment. So I'm glad you answered that question because I wouldn't have known the answer to it. So thank you. That's teamwork right there.
Absolutely.
So no, not particularly. I think it's going to be interesting to see how the partnership with the ICBs works, what that looks like in terms of what they then write into a local area inclusion plan about some of these roles and some of how they're going to tackle some of the gaps in the system where health and education really need to, health and the local authority really need to work together. And the LSEC pilot's one of those things. And, you know, one of the challenges we're seeing there, for example, is in some areas it's all very well to have this great idea, but if the workforce don't exist to recruit from, it's quite difficult to make the pilot work. And actually, what does that mean in terms of health and education departments working together at the centre to think, what does the workforce strategy need to look like going forward to support some of the things we're trying to achieve together to make the system work better.
Cool. Right. Next one. Will the department be looking at the early years, especially the first 2 years of life? Obviously, there's been a lot of important evidence coming out about the importance of the first 1,001 days, especially in terms of prevention. And the questions especially about the support given regarding health and development by the 0 to 19 service. So is that something that the CPPs, have they been starting that young, Alistair?
Not particularly. I mean, the LSEC pilot is aimed at early years settings. So that's probably a bit older than that sort of first, for many will be a bit older than that that first sort of 1,001 days. There is a whole lot of work going on early years, but I don't want to sit here and pretend that I know very much about it and sort of second guess it. So mainly where the change.
So I was just wondering whether, and maybe people can tell us in the chat, it may be that's a theme for either a future webinar or a future event, if we've got, and we can get one of your colleagues along to tell us about all the work that the department's doing.
Yeah, I mean, early years should be very much part of, or early years providers should be very much represented on that local partnership, and writing into the local inclusion plan what local areas are doing about early years is one of the things we're asking them to do. So in that sort of strategic sense, it should be included, and we will find out how well or not it has been when we start to see and assess those early inclusion plans when they come in.
Okay, now the next one I am going to get Lorraine to pick up, not right now, but when she speaks later. So Lorraine, can you hold and remember the question about how close we are to a national job description for DISCOs, for DCOs as well as DISCOs? I suppose you're not going to be able to answer the DISCOs one, so probably nobody's going to be able to answer the DISCOs one right now, but Lorraine can tell you about the DCOs one. Okay. And also about whether it's going to be made statutory, although Lorraine doesn't have a crystal ball, so that may be slightly beyond her. So has there been any consideration, Alistair, about how national MATs fit into regional delivery models? There is a challenge around local ways of working when local schools who are part of national MATs have some of their own ways of working and values.
I totally understand that challenge, and it's a difficult one, and I think everybody recognises it's a challenge. I don't think anybody quite knows what the answer is at this stage, and I think one of the things that we will be able to evidence through the change programme is how easy is it to engage your local schools in a strategic partnership to write an inclusion plan that we want them to hold themselves to account for delivering, when some of those schools are part of multi-regional MATs that have a different ethos to what everybody else is trying to do in their local area. And I think one of the beauties of the change programme and the way we designed is it starts to actually enable us to evidence that challenge, rather than just us all intuitively go, we know it's a challenge, to actually be able to, if you like, give that hard evidence of why this is a problem. Some areas may come up with some solutions to that, which would be very interesting to see if they do, and that's part of why we want to test the partnership to see what sort of solutions do areas come up with. Whether that then leads to a shift in the design and structure of the system as a whole, I think we're too early in the journey to be able to start to speculate what that might look like, and whether there'd be the appetite to make that sort of level of change at this point in time. But it is something that we're very alive to and want to learn about and evidence through the change programme.
Thanks, Alistair. There's a sort of a few more questions about, which again, I'll perhaps come back to Lorraine on as well, about bringing specialist skills into mainstream schools. Yeah. But is there kind of just, sorry, this is a very ill thought out question, Alistair, but are there aspects of that in terms of kind of specialist teachers or anything that the department have got plans around? And I guess just maybe updating people on where we're at with things like Ed Sykes.
Yeah, so the whole specialist, we're starting to have quite an interesting conversation about specialists and experts, and I think we need to shift some of our language a little bit, because I think when we say specialist in a room like this, you've probably got at least 10 different understandings of what we mean at that point in time. So yes, we're doing work on education psychologists. We're hoping to get 400 through the programme, but obviously they will enrol from September, and it's a 3-year doctorate. So, let's not hold our breath on seeing them in the system anytime soon, because it takes time to train and get your qualification as an education psychologist. The LSET pilot, I think, is the example I would use here in terms of just what we're trying to achieve across the system, which is can you create that rapid response service of specialists, so people who understand speech and language, understand how the toolbox of things that we know work can be applied to and used to help support children? Can you do that in a way that they're available to respond very quickly when needs first emerge? So you have a 3-year-old who's beginning to just deviate from their age-related expectations. Let's get something in place straight away rather than waiting for them to deviate massively and then doing a whole waiting list for getting an assessment, waiting list for getting some help. We know what that toolbox is. It doesn't take a speech and language therapist fully qualified to help start doing some of those interventions. So actually, are there, I have to be careful with my language here, not to offend anybody, but below that speech and language therapist role, that fully qualified top tier role, if you like, there are other levels of people that can provide that support and help. And actually, how do we utilize that in a different way in the system so that the system becomes much more responsive to need much earlier in a child or young person's life? And that's the sort of thing we're going for. So again, bringing your AP expertise into your mainstream. As you start to see challenges emerging, let's get that support and help in right up front straight away. Let's think about our AP specialist task forces and that multidisciplinary team that we've got set up around some of our AP schools in the country that are actually all about bringing together those professionals where the children are at. So that team around the school model, if you like. And so I've noticed somebody slightly tongue-in-cheek comment about Sure Start in the chat. Yes, those sorts of models, and I think we are coming back round the circle of the conversation to those sort of models again, and saying actually we need that sort of team around the school, rapid response, early intervention type approach here. But that comes with a whole set of challenges, and one of the biggest is where's the workforce to make that happen? And that's why we are having those conversations with DHSC, and particularly the Department of Health and Social Care, about what is the workforce strategy going forward. If this is what we think is the thing we need to do, how do we develop the workforce to enable us to do it, rather than it all resting on that top tier of education psychologists or speech and language therapists? Actually, let's utilize the full workforce to help us do this. And some of that is about how do you upskill the classroom teacher or the TA to be able to, for example, do some of those speech and language tools and use them, because actually they're not difficult. You don't need to be trained to use them. They're just a technique that you can show somebody how to use in a classroom at that sort of bottom level of intervention.
Thank you so much, Alistair. And Andrea, I would bring you in, honestly, but I'm already running 3 minutes behind time. So can I get you to put your question in the chat? And we do promise DFE are great in terms of if we don't get to a question, then you do promise to come back over. They'll come back to us with the answers where they're possible. Some of your questions are very quite philosophical. And involve us sorting more than SEND. Well, not just, I suppose they are all related to SEND, but some of them are slightly wider than Alistair's brief, wider than Alistair's brief is. So we will come back to you with all of the answers that we possibly can. So many apologies, Andrea, for not calling on you to speak. But really important that we have that we don't squeeze too much out of the break if we can in the traditional style. Thank Alistair very much. I know you've got some clappy hands there somewhere. I know in your, there you go, Alistair, you've got love and claps. So
Awesome.
Thanks very much indeed.
Thank you.
And now I'm going to hand over to Steve Shaw and Lucy Hart. So lovely to have both Ofsted and CQC here. Have they popped up? I've got my
I'm here,
speakers.
Amanda.
Marvelous.
Hopefully, I can see Lucy as well.
Excellent. That's fabulous. Right. Well, you've got your first slide there, and I will hand over to you without further ado. Thank you so much, guys.
Great. Thanks, Amanda. And thank you for the invitation. We're really pleased to be with you. Always up for a philosophical discussion about SEND and AP at 10:15 on a Thursday morning. I'm joining you from a hotel basement in central London. We've got an Ofsted conference today with HMCI, so really pleased to be here. As Amanda said, my name's Steve Shaw. I'm a senior His Majesty's Inspector, and I work within Ofsted's what's called cross-remit education team. So we have ownership and oversight and responsibility alongside CQC for our area SEND inspection framework, and also everything that we do in the school space in terms of inspecting SEND and AP. So that's me, and I'll pass over to Lucy to introduce herself.
Thanks, Steve. Hi, everybody. I'm Lucy Hart. I'm one of the managers from the children's team in CQC. So that's where the SEND inspection activity is delivered from. So it's the children's services inspectors that contribute to all of those elements of the SEND inspection framework.
Okay, so we've been asked to speak about our the learning from our area SEND inspections so far, and also the work we've been doing in the AP space, especially the AP thematics visits that we did, and the report of which has just been published. And during this presentation, I'll put the link to that in the chat if you've not had a chance to see that yet. Next slide, please, colleagues. Thank you, and over to you, Lucy.
Great. Thanks, Steve. Thank you. So I think most people will know that in 2020, DFE, with the support of DHSC, the Department of Health and Social Care, commissioned Ofsted and CQC to develop a new area SEND inspection framework that was to operate from early 2023, which is what we have been doing. So the aims of that inspection framework was to ensure that there was no accountability gap between the two inspection frameworks, so from the previous SEND inspection activity to what we are current day. That the SEND inspection framework included a greater focus on the experience of children and young people with SEND and their families. So we've really built that into the methodology through the case tracking and through conversations with children and families during the SEND inspections. Another aim is that we give more prominence to the quality, integration and commissioning of education, health and care services. So thinking about how those services work together. And also that the framework includes an evaluation of alternative provision commissioning. If we can go to the next slide, please. Thank you. So this, we are a year on. So just an overview of where we are at this point. So we have completed 26 full area SEND inspections and 6 thematic visits in our first year. So those thematic visits have been about alternative provision, and I know that Steve's going to talk a little bit more about that after me. The inspection outcomes from the framework include a spread of judgments across typically positive, inconsistent and systemic failings. And so that is then what predicts when Ofsted and CQC will be going back to do another piece of inspection activity under the full ASEND framework. And we have started inspections this year, so there's a number of inspections as well that are live in addition to the 26 that have been completed. And we also know that our monitoring inspections is on track to take place from autumn 2024. So just as a reminder, the monitoring inspections will happen around 18 months after the previous SEND inspection, where a SEND inspection has identified systemic failings. So that's the context for the monitoring inspections. And it will only look, that's a kind of a focused look at the areas for priority action that were identified at that initial full SEND inspection. If we can go on to the next slide, please. Great. So these are the learning that we've identified so far from our first year of inspections. There's some of the things that have really come across strongly from the 26 that have been completed. Is where we've seen, where we've identified significant weaknesses is that there is limited or no mitigation for long waiting times for some health assessments. So it's really hard to pick these out and think about them separately because they become all linked to each other, and certainly you'll see that from some of our reports. We've identified that there are some poor quality and also poor timeliness in education, health and care plans. That it goes across the that sort of talks to different points. So we've seen different elements of poor quality. So either that there's a lack of quality assurance processes that mean that those poor quality EHCP plans can be that there's an opportunity for improvement, or perhaps that sometimes there isn't inclusion across the partnership in terms of contribution to EHCPs. We've seen that there's limited specialist education places to meet identified needs, and that there are some weaknesses in governance and partnership work, including limited use of data across the partnership. That's even thinking about when that data is available, how it's used across those SEND governance structures in that local area partnership. If we can go on to the next slide, please. So the things that have been positive that we have identified is some really good examples of proactive early years support, some very creative working by frontline staff. So despite some of those issues that I've just spoken about from the previous slide, that frontline staff are being creative to be able to deliver their roles. We've seen improvement in co-production in some local area partnerships, and that the voice of children and people in EHCPs is particularly strong in some local areas. If we can go on to the next slide, please. So you'll also know that we started to deliver our SEND engagement meetings, and it's really important just to highlight from the handbook and framework that these meetings are about having a spotlight on SEND for a local area partnership. We've already seen from them that the engagement meetings support improved joined up working with the local area partnership. It's useful to have those conversations with the local area partnership, and we've identified some key elements that are more helpful for the engagement meetings. So, for example, sharing questions beforehand is useful to consider that partnership's effectiveness. And also it's a helpful opportunity for local area partnerships to have a discussion about how we think about impact measures on children and young people. Go on to the next slide, please. Just thinking about our areas for priority. So our reports aim to identify clearly where accountability and responsibility for taking action should lie. But also in doing so, we recognise where there are national issues that are having an impact at a local level. So we're really trying through our reporting to highlight anything that's positive within that, and the actions that are being taken by the local area partnership to mitigate some of those issues. So that's really thinking about some of the issues that we highlighted on the earlier slide when we were thinking about key themes. So it's really important that we know that there are national issues, that our SEND inspections are looking at what the local area partnership is doing together to mitigate some of those issues, and that it doesn't automatically become an issue in every local area partnership. And I think I'm handing over to Steve. Yeah, thanks, Steve.
Yeah, thanks, Lucy. So colleagues, I'll talk for just a few slides around the AP thematic visits. I'm conscious that there'll be people in the meeting today who are involved in AP commissioning. And I think it's also worth just acknowledging right at the outset that we're very much aware across Ofsted and CQC that AP is increasingly being required to take on some of the pressures and the challenges that are facing the specialist settings sector, and is in some ways acting as a proxy or shadow SEND system in itself. So we're very much aware of those sorts of challenges facing the colleagues and the professionals who work in AP. Next slide, please. So the AP thematic reviews were carried out under the Area SEND framework. So we carry out a series of thematic visits each academic year to investigate a particular aspect of the SEND system in depth as part of our Area SEND inspection arrangements. Our visits in 2023 focused on alternative provision, where we sought to identify systemic concerns and draw out examples of good practice. On the 1st of Feb this year, so very recently, we published our findings in a national report to highlight examples of effective strategic planning, commissioning and oversight of AP placements, as well as barriers and national challenges. And colleagues, I placed in the chat the link to that report, as I said earlier, if you've not been able to see that so far. And we found overall that there are gaps in knowledge around AP and AP commissioning including how AP is currently being used and how local area partners are working together to commission and oversee AP placements. Next slide, please. I'm not going to read that slide, colleagues. You are going to get the deck. What I'll say is that this is a slide from HMCI, Sir Martin Oliver, and there are some quotes on there that reaffirm his commitment to the importance of understanding and inspecting AP and reflecting the importance of it in meeting the needs of some of our most vulnerable young people. It's quite a text-heavy slide, so as I say, I'm not going to read it now, but you are going to receive it in the deck. Next one, please. So our report's key recommendations then. There needs to be better guidance on the purposes of AP and potential indicators of success. I joined the meeting after it had started, so I don't know the extent to which you were discussing with Alistair things like national standards and how we can possibly fairly and reasonably judge alternative provision, because outcomes there will look very different in many cases to how they look in a mainstream school. So there needs to be, as part of that SEND improvement plan, also for AP, better guidance on the purposes of AP and potential indicators of success. We also found that we need clearer roles and responsibilities for different local area partners, with more clarity on how health and social care partners should be involved in strategic planning for AP and the commissioning and oversight of individual placements. So that goes back to that point that Lucy made on an earlier slide around that joined up thinking, that partnership working, that shared planning and governance across a local area. We need greater clarity there. We need improved oversight of certain groups of children and young people in AP, including through the introduction of a proportionate registration and inspection regime for all AP. Without getting into the details of that now, you're probably aware that at Ofsted and CQC, we've been pushing for some time for increased regulation and oversight of particularly unregistered AP, where some of our most vulnerable young people can be placed by schools and by local authorities. And it won't surprise you that one of the findings of our report was that we do need to push that further. And we're working with the DFE and talking with DFE around proportionate registration and how that might be inspected for all AP. And there needs to be greater consistency and rigour in decision making around individual AP placements and subsequent monitoring and evaluation arrangements. What we often find on inspection where AP isn't going as well as perhaps all of the different stakeholders hoped it would be is where there hasn't really been sufficient monitoring by the Commissioner. There hasn't really been any meaningful, effective quality assurance of the arrangements for those young people in AP. And that might be from the local authority as the Commissioner, it might be from a mainstream school as the Commissioner. So there needs to be greater consistency and rigour around individual AP placements. Otherwise, we're at risk of youngsters being, if you like, dumped in a provision so that they are even becoming out of sight and out of mind, which is not what anybody wants. Next slide, please. Okay, we have taken quite a canter through our Area SEND framework there and the AP thematics. We're happy to take questions in the time that we have, Amanda, but also similarly to Alistair, very happy to have these questions put to us later, and we'll very pleased to respond to those through the central organisation. So that's no issue if we're not able to get to questions now. So Amanda, over to you.
Brilliant. Right. So have we got some questions? Let me have a look quickly in the chat. Sorry, there've been a lot of questions about the sharing of the slides, and I've been slightly distracted by answering them. So we have got a question, and I don't know whether you'll be able to answer it, but I think it is one that exercises people a lot, I know. So it's about how we align the demand for education, health and care needs assessments from health with long NHS waiting times, and the fact that what that can mean is that a child, because they need an assessment, then jumps to the head of that queue, and that's what the law says should happen. But that then might mean that that impacts on provision for children where there is provision in their plan. So, I mean, I could tell you the legal answer, which is you need more provision. In that case, you clearly haven't commissioned enough. But I understand that that is not a simple answer. And I will ask Lucy to reflect on what CQC's response to that would be.
Yeah, thanks, Amanda. And I think it is really complex, isn't it? And there are, I suppose, some unintended consequences as well, aren't there, that can play out. Our focus when we carry out the SEND inspections is to really understand how the local area partnership are managing those demands and those issues in terms of waiting times, and the impact that has then on EHCPs. There are times where we have seen some creative solutions, but I think that it would be unfair to say that we have seen a solution and that those solutions have fitted for that local area partnership, but it hasn't necessarily resolved all of the issues. Otherwise, I think we would be in a really different place, wouldn't we, to where we are currently. So I think it's a real challenge. And we are doing our very best to understand area by area what people are doing and reflect that in our reports. I think you're on mute, Amanda, sorry.
That's quite a bad error for a chair, isn't it? And I guess that is the theory of change really behind the Send an AP program. You know, if we can get, and if we can get some of the great suggestions that have been coming up in the chat and some of the things that were slightly covered in the questions with Alistair, if we can get that specialist upskilling into everyday delivery of teaching, then the idea is that we should have fewer requests, because actually people will be able to see their children's needs are being met. So I think the difficulty is at the moment is that we're asking everybody to square a circle until that happens, and it's incredibly difficult. But my sense is that from both what you've said and from your slides, Lucy, is that, and also from what I've seen in the inspection reports, is that you absolutely recognise that the issue with the long waiting lists is almost universal. It's about the action that people are taking, and the fact that you don't want them just to be sitting there saying, well, that's what's happening everywhere. You want them to be seeing it as a problem that they need to solve. Yeah,
absolutely, and that we can see that. So thinking about some of that, the kind of leadership and the commissioning, because you mentioned about commissioning before, Amanda, is how inspectors can understand that through the evidence that might be provided either during the inspection activity or through that Annex A request. It's really about getting into that local area partnerships approach, because otherwise you could argue that we could write the reports then before we go on site, which so it's really understanding what that local area partnership approach is, and we hope through the methodology that we know that we've got the opportunities to be able to do that through understanding the strategic approach, but also really thinking about what is it like to be a child young person in this area.
Lovely. Thanks, Lucy. Now, Steve, we have got a couple of questions about AP. So just before I hand over to our next speakers, because you did start 3 minutes late, so I'm going to give you another 3 minutes for questions. So we've got, is online AP considered
through ETH, Inspecting the Mainstream School, where online AP was being used. We'd want to understand the particular context and nature and purposes of that provision. We'd want to understand the safeguarding arrangements, as you would expect, about what exactly is the nature of this online provision, who's delivering it, where are the young people receiving it, are they receiving it at home, are they receiving it in a centre, who's commissioned it, is the online provision registered as part of the scheme that we inspect? So there are various questions that we'd want to ask. So potentially it could be considered appropriate as part of a young person's overall curriculum package, if you like, but we would want to understand on an individual basis how it was being used, what the safeguarding arrangements were, what the quality assurance arrangements were as part of that wider local context, whether that be the area context or a mainstream school context. And on the second question, yes, we have. We've said throughout the report that there needs to be closer working relationship between the different commissioners who are active in an area. We know from local authorities and we know from DCSs and heads of inclusion that a frustration when we ask questions around what's happening in terms of AP commissioning on your patch. Understandably, they feel that, well, we can only really be responsible and actually are only responsible for the commissioning that we're undertaking. We've got much less oversight and far fewer levers for what other settings and mainstream schools might be doing. So recommendations in the report are around, through the DFE, because it would sit with them to make these, to give us these levers to inspect against. We've certainly said that there needs to be closer oversight and quality assurance arrangements across partners so that LA commissioners have clarity and have some role and involvement in what those commissioning placements are and the quality of them. So that does run through the report in terms of that broader, more general partnership work, and there are recommendations in there that we've made to the DFE that sit within that area. So hopefully that answers those two questions. And I saw something else in the chat around this year's thematics. This year's thematics, yes, that they are around preparation for adulthood. So the first one is being announced in a couple of weeks, and then there are 5 more in the summer term. So that's really looking at everything that's in the code of practice in that PFA strand, are areas that we're going to explore during those thematic visits this year.
Brilliant. And if you can, in 30 seconds, the two of you, answer the question about any themes across the areas found to have had strong SEND governance structures.
Yeah, do you want to go first on that, Lucy, or shall I?
Don't mind, I'm just coming off mute. Should I go first quickly, Steve, and then you can finish off and say go back to that has been about in terms of evidence and what we would be looking for, that those issues that are issues for the local area partnership, so take that as either national issues or issues specific local, that we can see that there are channels for those issues to be identified. There are channels where those issues can be escalated. There are responses across the partnership. So those governance structures bring in the partnership, and that there are plans to be able to address those issues that are measurable across the partnership. That probably is my kind of headline point. Steve, whether you want to add anything?
I would agree with that. Where we see it working really well, there's absolute clarity around the role of, and they call different things in different areas, scrutiny panels, different work streams, elected members, the portfolio holders taking their responsibility for holding the executive, the senior leaders to account for what's in the strategic plans.
That is super. Thank you so much, both of you. And I'm sorry, there's so many more questions I could have put to you from the chat, so we will share those with you, and you won't be able to answer all of them, but we'll try and find answers from other people where you can't. So if we could again thank Lucy and Steve. Before I hand over, you can put your camera back on, Lorraine. It's all right. We know that you won't be sucking up that applause that was meant for other people. So thanks again, Lucy and Kate. Delighted to hand over to Lorraine, Rachel and Sally, and that's all I'm going to say, so that I don't take up any more time. over to you.
Thanks, Amanda. It's great to come today and not do a session and have other people talk on our behalf. So I'll introduce Rachel and Sally in a moment. But just as you mentioned earlier, a couple of questions came up. So I'm Lorraine Mulroney, the head of SEND in NHS England. I think Matt Powell asks me a question every time about where we are with the designated clinical officers. Sarah Childs and my team leads on that work. Sarah's here with us today. She's going to pop on camera. But Matt, just so that you know, we have an expert reference group. It's meeting again on the 19th of February. We've been looking at around 10 to 12 job descriptions. We're mapping all them. We're continuing on with the work, but this is not going to be quick. So if you remember from the improvement plan, the commitments around roles and functions from designated clinical medical officers linked to updating the code of practice isn't going to be happening until at least 2025. So we continue on with the work, learning from what is working well, and building up the evidence base around job descriptions, roles, team approach, not individual roles as such. So if you want to know more, Matt, if you ask Adeline, who's your Southeast lead, and we can get you connected if you would like to come and support us. On the specialist workforce side, Amanda, you asked me to talk about that. There is a workforce commitment and the improvement plan around it's the National Health Institute for Research. There is a bid out at the moment. It closes on the 13th of February, and that is to look at the demand and capacity of therapy services. So we're working with Department of Health and Social Care and DFE on that. We have a national workforce group. So we're talking lots about the workforce and how we bring the workforce elements across education, health and care together. But from a health perspective, we're working really closely with the colleagues from the Department of Health and Social Care who worked on the NHS workforce plan. So there is lots going on in the background. Our focus is all about supporting colleagues who are working alongside the change programme partnerships and the national policy colleagues, and colleagues who you've just seen earlier around inspections through our delivery and the regional teams in terms of post-improvement support. So it's very busy at the moment, but I'm delighted not to be telling you much more. And I just want to introduce Rachel and Sally. So this piece of work was originally commissioned by us in the national team. The North East and Yorkshire team took it on as one of their projects around leadership and development. There are two pieces of work. They're going to talk to you about where we've got to and where we'd like to go, and for you to have an opportunity to give us some feedback. Tell us, is this good? Would it help? Appreciate it's very health orientated, but I'm sure Rachel and Sally will tell you more. They've been working really hard on this with external stakeholders. So over to you, Rachel and Sally, and thank you for all the work that you've done so far on this.
Thank you for that, Lorraine. I appreciate that. So my name's Rachel Wilcox. I'm designated professional SEND manager for NHS England, and we've got Sally Newsom, who is the head of SEND Children's Continuing Care and Personalisation from Humber, North Yorkshire as well. And we've worked together on this project, and it's been a pleasure for the last year, I would say, around that. So next slide, please. I'm going to talk to you first about the SEND Quality Improvement Framework. Now, when we first set about this, the NHS is gifted with an awful lot of quality improvement frameworks around various different subjects and subject specialists. So I spent a long time alongside Samantha and Sam Barron, who some of you know, reading a lot of these and going through a lot of these and really researching what was helpful. And what we found was what we were looking for, something that was different. And what did SEND have and what SEND was compared to the other quality improvement frameworks that were out there. And what we found really was that actually SEND is a tripartite. That's not new news. This is across local authority, education, social care, but much more importantly, parents and carers, children and young people. And what we didn't have is a real clear framework around what quality meant to parents and carers and children and young people. And actually co-production needs to be the forefront, and we wanted to really describe quality and form our framework around that. So Sam and I set about engaging with two groups, Children in North East and the Multi Schools Council down south, and also the National Network of Parent Carer Forums, sorry. And we were lucky enough, we had 720 families engage online with a survey around this. And we had 120 young people, all with sort of various needs as well across various ages. We were lucky enough to get drawings and pictures and all kinds of feedback, which was just wonderful to have. We ended up engaging CDC to support us with some of the analysis, because we ended up with 7,000 bits of information to try and analyse and go through. And it was a pleasure. And out of that, we got 8 key principles from that information, including the sort of analysis of the research in there as well. From the children and young people, they talked a lot about growth or growing, and the visuals that they provided us showed trees and flowers and grass. And I think that kind of meant a lot to them, and we stuck with that as a visual model. And we've sort of played around with that and gone back to the groups for their feedback to make sure that it kind of fitted what they saw. And I'll show you that in a second in the next slide. But you know, we've stuck with the tree model, and we've come up with those 8 key principles as that trunk of the tree. We then built a process, but the process was built on the NHSE quality improvement cycle that has been around for a long time. And what we wanted to do was make that practical so that it could be applied at all levels. So parents and carers can apply this, children's groups can apply it, we can apply it at a local authority level, at a strategic level, and at a place level. It was really important that the same quality improvement process could be applied across all areas. And we also looked at the quality improvement tools and tried to apply them to those different systems, places and teams levels. We go to the next slide, please, Macy. So this is our visual model, and feedback is very welcome on this, please. I know some people have seen it, and I've tried to get this out as much as I can when I've been talking to people so that I can get some feedback on it. Now, down in the roots there is where our growth is. And sort of thinking about actually what we have to base all of this on. Things like our policies, our procedures, our NICE guidance, strategy, effective commissioning, the improvement plans, task and finish groups, all of those things. And I know that there's a raft of things missing off there. And I think, you know, comments on what else could be added or how we could rephrase that are very welcome. And there you see our 8 key principles, and I have to say, I'm very proud of these because they've taken a lot. We've really considered the language around them. That early support, joined up working, clear communication across the system was huge, by the way. Co-production and partnership. Compassion and care has changed a little bit to compassion, care and voice, because we really wanted to pull out that voice was important. Skilled workforce, equitable provision and accessibility. Accessibility was really, really important to our children and young people. So none of these are in order, but it's very, very important. And in that stable trunk, we were able to make improvement happen across all of the systems in care pathways, again, in no order, and that's important to remember. We did talk about bits of fruit dropping off, and so that it became a full circle, because actually what we'd like to see is those improvements beginning to sort of feed into policy and feed the ground and the roots. So if anybody has any ideas around that, then we can sort of think about it. But when I added it, it kind of it looked a bit daft and we couldn't quite make it work. So if anybody does have any ideas, please feed back. Next slide, please. These are the 8 key principles. You'll see again that voice, that compassion and care and voice will be expanded into that. And here we talk about Voice of Young People, but we've expanded what those each of those sections are. In the actual finalised document, there's links to comments from parents and carers, from children and young people, links to some of the research that we did. And so there's real evidence as to why these 8 key principles have been picked. And that's in that completed document that we will be looking to upload onto the CDC website at the end of February, hopefully, so that we can share it for feedback and for testing. And it was important for me to link that and link particularly what parents and carers and children and young people did. We know the evidence is there for this, we know that, but actually why? Why is that important? And that is our why, really. Next slide, please. Thank you. So this is our NHS England system approach, really. And again, in the actual framework under each of these, so developing a quality improvement partnership, that is the absolute first thing to do. When we talk about who, how, what should we do, what needs to exist within there. So it gives a little bit of guidance around what to do with that, because sometimes it's a bit, how do we even start this? And it's around creating that shared and understood aim. What we know around partnership working is, as long as we keep that aim and those goals close, we then are able to develop that change effectively. That joint planning, joint implementation, joint review and evaluation, all of those sections are explained in more detail in that cyclical form to think about how we look at this and how you operationalise those 8 key principles within it. And a little bit about the next step to that will be to create a document that you can use to RAG rate your aim and your quality improvement against each of those principles, so that you can use it as a functional tool as well. Next slide, please. Thanks, Macy. And I've played around with this a little bit because I realised this is a bit of a messy slide. It was a box originally that read down over, and that didn't really work either. So we are playing about, but again, any feedback. And this is not an exhaustive list, and it does say that. So we've got a bit of blurb around what are quality improvement tools, what can be used and how they can be used. And sometimes it feels like it's a bit of a raft. So what we really tried to do was think about actually what tools are effective at system, what are effective place and population, at a pathway level, at a team or service, and at an individual level as well, because we can't forget as an individual, we also quality improve ourselves within this system. It's ever developing and ever challenging, and I think we sometimes forget about ourselves within that. So I really wanted to think about that. So there I've listed, and you'll see some of those quality improvement tools can be used across the board and at different levels. And within the actual document, there are links to each of these tools about how to use them and how to use them effectively. And within new systems, how to access those as well. So I've really tried to sort of make it more practical, I think, and make it accessible for people, because I realise this quality improvement theory can feel a little bit inaccessible as well. I think, and that's kind of the quality improvement framework in a nutshell, because I could really talk forever on it, and I think we do plan to do a bigger piece of work on this when we look to officially launch. But I would be very grateful for any feedback that you have, and even if you feel this will be useful in the system, and anything that you particularly found useful, or any questions that you have about it, I'm happy to answer. But I'm going to hand over to Sally now, because the second piece of this work was around leadership and accountability framework. So thinking about actually developing a levels-based system. So Sally, I'm not going to tread all over any more of yours, so I'll let you come in and introduce it.
Well, thank you, Rachel, and thank you for that. That was really, really helpful. So this second project really spoke to me in my role as designated clinical officer at that time, because I come into the role and I couldn't find a practical guidance of SEND. So what I was supposed to do and how that was applied and what that governance was at different level and what my responsibility was. So there's lots and lots of legislation and guidance around this, but what was the actual practical application? So when I spoke to NHS England about bringing this document together, I thought this is something I can really get into. This is something that's going to be really practically helpful within my role and within health. It's very different to the quality in that it's a very health-driven piece of work. But as I run through, you'll see why. So it's bringing together different parts of innovations and legislations that are already there into one document with the main aim of really outlining our accountability and responsibility and that leadership framework in health. There's lots and lots of innovations that we've all been part of with Council for Disabled Children and one another, and it was the aim was really to bring the kind of the real essence of it together and then able to use it within our health services. I also wanted to look at that leadership responsibility right from NHS England down to our ICBs, down into to our provider services, so we could each take accountability, because one of the things I did find was SEND is quite a specialist area. And we, people on this call today, for us it's our bread and butter, we know this and we're passionate about it. For other parts of the system, that's not always the case. So I needed something to be able to really elevate SEND, something that would be really quite succinct and that we could share. I wanted to be able to influence change within health to become that partnership level. So not the kind of being pulled along, but being up there as a system. And in the future plan of this document is to look at aligning it with the Royal Colleges. So getting that intercollegiate agreement. That's what really helped with safeguarding, when we had that intercollegiate document that really outlined what we needed to do. We move on to the next slide, please. So the different elements within this was around leadership, accountability. There was some brilliant work that we'd done with the Council for Disabled Children and led by one of our brilliant DCOs in down south that I've been part of and I've been privileged to bring up to where I was in North Yorkshire and York. And then roles and responsibilities of health professionals. So really kind of being able to say, okay, as a community nurse, this is my responsibility. This is not just a specialist subject, or as a paediatrician, or as a DCO, or as head of an organisation such as the ICB, and where that accountability fit and where that competency framework, what I would need to know for SEND, how that all tied together. So that it wasn't one person in an organisation shouting, have we remembered SEND? Do we know what our responsibilities are? So thank you. Next slide. So this was around looking at what specific staff groups would do. And there was already, as I said, there was already some work around the training levels. There are 2 levels on the Council for Disabled Children website at the moment that we can access. There are further levels in development. But this was around being able to bring in not just training, but the competency levels. What do people need to know and what is their responsibility? So we really wanted to define what that next step was to our leadership. We also wanted to look at the further recommendations from our providers themselves. What do they want to know? What do they need to know? So we took this out to our providers. And so there were a lot of extra levels added in there, a lot of extra staffing groups in there. And in fact, what we looked at when we applied this model was a 3rd level of interactive EHCP training that we applied in North Yorkshire and York, that's led by the local authorities, legal department, and our designated clinical officer and associate designated clinical officer. Apologies, Charlotte, name prize, if you're on this call, you've done a lot of the leading of that. And that's worked really well. We get about 65 people on each session, and we really go through writing an EHCP. I think this is one of the main things that came out from doing this piece of work, as we were quality assuring something we'd not had the training on in the first place, and it was that chicken and egg situation. If you could move on to the next slide, please. So here's just a little bit more around what those levels look like. So at the level 1, it would be anybody that works within health that doesn't have maybe direct contact every day, but needs an awareness of the of SEND. So if you're a non-clinical manager, if you're a receptionist, if you're a porter within a hospital, and then we go right down to having that really specialist knowledge on level 5 with that designated clinical officer and medical officer. And we also included in there heads of ICB. So there has been some further work on this, because if you're going to be a senior responsible officer within an ICB, you need to know quite a lot about SEND and our responsibilities and governance around that. So if we move on to the next slide, please. So I think this is probably the most helpful slide for me. This is how it's been practically applied over the last 18 months within North Yorkshire and York ICB. So we've got a really clear outline for the senior responsible officer, who within Humber and North Yorkshire ICB is the chief nurse. And then there's a new post that's come about, which is my post, which is the head of SEND and children's continuing care, and what my responsibilities are to that as a partner within this SEND system. What we have managed to do is, because we've had that training implemented within North Yorkshire and York Place, is get that agreed right across the board for implementation for all NHS providers within our 6 areas, because we've seen the difference that has made for children and families, and for working as partnerships, when we all know what our responsibility is and we all know what our governance is and where we feed into and who's responsible for what. Within the Humber and North Yorkshire ICB, we're setting up a SEND committee for our ICB governance and our reporting structures. So we're going to be using the quality assurance framework that Rachel's spoken around to really have those, set those KPIs, those key performance indicators for health, so we can bring that back to our partnership and really have SEND, escalated and elevated as it should be. Using the document, we've been able to really solidify that partnership working in terms of working with other people, parents and carers, and our systems partnerships. And so we're setting up a steering group in particular for our parent carers to speak with the heads of our ICB. We're setting that career pathway for SEND. If this is your responsibility and accountability, it doesn't stop at DCO. We're moving up into some senior positions, and this document helps do that. I can see Amanda's in the corner, so I'm going to speed up a little bit. So then we have the quality assurance framework using the EHCP training and the training levels in line. We've managed to get 97% of our health advice back within 6 weeks timescales, because people understand why we're asking them to do it. It's not just, you will do this. It is, please, we need to do this because it's a statutory guidance for these children and young people. We've got the paediatric SEND health assessments in place, because an understanding of what we need to be able to provide into our EHCPs, and our quality has come up to 86% because of the training, because we're able to ratify that within the ICB and align it with our training. Then we've agreed that standard of quality with our partners. And 94% of our specialist children and young people staff have gone through this mandatory training. Some of the areas, the ICB board has recommended the training as a recommendation, but our partners within our health NHS providers has picked this up as mandatory across most of the areas and are reporting on that. So it's a real practical, how do I do this as a single person within a DCO or a set of people within an ICB, and really influence. I mean, this is nearly 21,000 staff members across North Yorkshire and York in those NHS providers, and we do a difficult job in our role, but to have a document that's based in legislation to do that has been really helpful in our opinion. So thank you, everybody.
Thank you so much, Sally and Rachel. And you did overrun. Eve, I know I started you late, but I did let you overrun because it's such a good news story, and you were getting so much love in the chat that I didn't want to I didn't want to cut you short. We have had some questions which we haven't really got to. I'm going to just really cheekily, I'm just going to steal some of your break, guys. I'm sorry, that's what we're going to do. So there's just one question that I think people are absolutely loving this, but there is some anxiety around. So have, and clearly in Yorkshire and Humber they have, but have the ICS strategic lead sign this off in terms of implementation and sign up? Otherwise, we'll be reliant on individual passion. We know within the health system there is so much individual passion that has carried us so far, but how do we get beyond that, guys? What's the answer to that in this particular question?
In terms of the accountability and governance framework that's set in legislation, it brings it together in a very succinct document that you don't need to be an expert in SEND to appreciate, because it's the Children and Families Act, it's the code of practice, so it is solidified within that for you. And I'll let Rachel answer for the quality.
And for the quality improvement framework is going to be linked to another piece of work that we're doing alongside CDC, which is the quality assurance framework. So a lot of ICBs, and I noted that Christine had popped in about that a lot of ICBs are looking at their quality assurance framework, and we've been asked as North East and Yorkshire region by our SROs to create a framework that they can consistently report to. So we're doing that alongside South East as well. So Adeline Gibbs, who's the regional lead down there, and I are sort of exploring this within our regions, and we're going to link the quality assurance framework. So what again is expected in terms of reporting and governance, which is all based within legislation and expectation at each level. So a regional level, a system level, and a place level, and then we'll apply the quality improvement framework over that to provide a level of expectation or support. But you're right, it is reliant on expectation, on passion and people's want to do it. And we're hoping to make it accessible and easy and practical so that there is the ability and the want to do that. And us as regional leads constantly have those conversations with your senior leads too. So we will continue to support and continue to push it forward. I'll leave it there.
That's brilliant. Thank you so much, guys. And if we could all thank Lorraine and Rachel and Sally for a really great presentation. And welcome to Mark and Adam. So and sorry, I hope you didn't have something at 11:15, Mark, because you're going to be late. So I'm going to hand over to you. Really going to be great for people to hear about that sort of change role for alternative provision, and it has been lovely working with you as part of the REACH partnership. So good for other people to get to have a bit of experience of your very considerable knowledge and expertise. I'm going to hand over.
Thanks so much, Amanda. Yeah, really good to be here today, joined by my colleague Adam, and really enjoying being part of the REACH consortium. So, colleagues, for those who don't know us, I'm Mark Vickers. I'm the CEO, fortunate enough to be the CEO of Olive Academies. I'll say more about the organisation in a minute. Adam is the deputy to the trust, and also he leads on that on our role within the REACH consortium, which is obviously the delivery partner supporting the department on the change programme. So, if we could just move to the next slide. What I'm planning to do in my first piece before I hand to Adam is to talk, to frame the importance of partnerships through helping you to see what alternative provision is through the lens of Olive Academies particularly, and then we'll come into just having a look at what the kind of issues are and why it's so important that the local partnerships work together on that. So just to start, that first slide just gives you those 4 values, and they're the values that are dear to Olive Academies. They are conviction, ambition, determination, reflection, and every piece of work that we do is driven through those values, and they were co-constructed with our young people from our first academy with staff and trustees, and that's really important to us. Macy, next slide, please. So for those who don't know about Olive Academies, that slide just shows you where we're currently operating in the core piece of our work, which is our academy work. We have 5 academies in 4 local authority areas across 2 Department for Education regions. That's London, because we're based in Havering, and in the east of England, which is Thurrock, Suffolk, Cambridge, and Dean Valley, which is based in Wisbech. Next slide, please, Macy. Thank you. So there's a lot of words there, but basically what they show is they're the range of different partners that we have at Olive Academies, and the work that we do is always predicated on we don't have all the answers. We have to work in partnership with a whole range of partners who have a vested interest in understanding the needs of young people who might have been commissioned into AP, and I'll say a little bit more about that in a moment, and that we join up and work together. And Adam will say a little bit more about a continuum in his piece, but we just believe passionately that young people have the absolute right to be able to access a high quality continuum, and all of those wonderful partners that are on those slides have a really important role to play, whether they be schools, because we often find ourselves quite rightly working to support the needs of schools through the work that we do, or third sector organisations, or just as importantly local authorities. And it's good to see colleagues from local authorities on the call today. Next slide, please, Macy. Thank you. So just a bit about the national context, because some on the call may not know everything about alternative provision. So just to sort of share some information there. So the most recent data set, which we've had from the department, just sets out that there were just under 32,500 pupils in registered alternative provision. And that was from within 348 different AP settings. And the breakdown there is on the pie chart there. Pupil referral units, which is the term that's being used less and less, but generally is sort of describing the local authority maintained provision. Just over half of those provisions were in that bracket. The growing number is alternative provision academies, just under 30%. That's gone up since that point, although we don't have the actual data. And quite a number of free schools which were approved in previous rounds, and there's a current round of AP applications just waiting for announcements to be made nationally. And of course, for those who don't know, any free school is automatically an academy as well. Next slide, please, Mason. Thank you. So a little bit about the current picture. Really important that we share that the sector, so the wider specialist sector, and that encompasses alternative provision and SEND settings, is very positive about the ongoing engagement that's been taking place with the department, really building on that strong work that took place at the start of the pandemic. I was really struck at the beginning of that pandemic how much the department reached out to existing networks. And there were 3 strong networks within alternative provision, of which one is the CDC National Network, which I'm fortunate enough to lead, and that has 48 multi-academy trusts from across the country in the 9 regions, part of that network. And we've continued that engagement ever since, really, through a couple of stakeholder groups which have been ongoing, the AP Stakeholder Group and the AP Stakeholder Implementation Group. And really linked to the outcomes of the Green Paper and the improvement plan there around confidence levels are really high that the department fully understands, because of all the information we've been able to share over time, about what the challenges are facing the sector and the fact that we need to work together to tackle them. Next slide, please, Macy. Thank you. So just a little bit more detail, go into some detail about what those challenges actually are. Not long ago, so at the end of November, my network put out a survey to all those 48 maps. We had responses from 46 of them, so it was a really good snapshot, which we share regularly with the department, so they can get a real-time, bit of information about what's happening in the school system at the moment around the specialist sector, particularly. And what they were reporting at that time may not be a massive surprise to many of you on the call, that there's a huge increase in the complexity of needs of young people, exaggerated no doubt by, we know, from the pandemic, and that's playing out particularly around increased levels of anxiety, playing out around SEMH needs, which is having a big impact on how they're engaging, as young people are struggling to engage within their school settings particularly. And we're seeing that playing out in terms of a huge increase in exclusions, which I'll give you some figures in a moment in the next slide. But this is the breakdown of what's happened there around those exclusions, with a big number which is going up exponentially around persistent defiance, and that sometimes plays into the piece that some schools have a very binary approach to how they manage behaviour, and some young people, particularly now with their increased needs, are struggling to cope within those systems and structures. Next slide, please, Macy. Thank you. So that just gives some more detail about the current picture. So it's really interesting that generally pre-COVID, AP settings wouldn't be full until around springtime, just around the Easter break at the end of the spring term. But actually, the majority of settings were full at the start of obviously the academic year, partly because that really important stat there, that 63% of AP settings surveyed reported that the threshold for managing behaviour is definitely less tolerant in mainstream schools. And that then plays out with higher numbers of pupils being commissioned into alternative provision. And interestingly, and we've had this at Olive Academies as well, it's getting harder to be able to get our young people, when they're ready for a fresh start in a mainstream school, back into their mainstream settings. And as I said, virtually all of AP settings were full at the beginning of the academic year, which has a big impact on commissioning, which takes me into my final slide. Thanks, Macy. Which is the challenges around commissioning of AP is only getting worse. The strong settings are full and are being commissioned to take on more and more where they can, but there is a limit to what those settings can actually offer. Standards in alternative provision have always been variable and often too low, and I'll say that to any audience that hears it, but there are some fantastic examples of really good practice, particularly where they're working in those organisations are working in good partnership. There's an ongoing national crisis, as you'll be aware, in teaching, particularly around recruitment and retention. no surprise that that's had an impact on the alternative provision settings as well, in terms of trying to keep the right people who are being offered roles in other settings with, you know, quite inflated salary offers at the moment. But it is a challenge, definitely, to make sure you have the right quality staff in front of the young people, which is what they all deserve. There is a challenge about attendance, but I'm not going to go into detail on that because I don't want to steal Adam's piece on his slide. So we'll just hand to Adam at that point. Thanks, Adam.
Thanks, Mark. The slide that is on the screen now is what we've referred to at Olive Academies as the continuum of inclusive practice. And the purpose of this slide is to highlight where we see good high quality alternative provision within a local SEND and AP system. We see Olive Academies and high quality AP sitting in that space between mainstream schools and the specialist sector. So, but not in a traditional way. In a traditional way, a PRU/AP would have sat there and taken young people who had been permanently excluded potentially and worked with them in their own settings. High quality alternative provision along that continuum of inclusive practice is about, within a developing SEND and AP system, is about reaching out to our partners, as Mark has described, about moving upstream and working with our colleagues and working with children and young people and their families within mainstream schools, but also working hand in glove with the local specialist sectors and our post-16 providers to ensure that the young people that are within our alternate provision, whichever way that's being commissioned, are getting a high quality inclusive offer. If we could move on, Macy, that'd be great. At Olive Academies, you won't be surprised to know that on this slide, well, first of all, on this slide shows the three-tiered AP model that is in the DfE SEND and AP Green Paper and in the improvement plan, and what we're testing within the change programme across the different change programme partnerships. But you won't be surprised to know that this model is what is reflected within Olive Academies provisions that Mark has highlighted across the east of England and London that we have. We are very, very massively supportive of this model, particularly the idea of changing the perception of what an AP provides within the SEND and AP system within a local area. So we are more and more, and I'm going to come onto this in a little bit more detail later about our outreach, but tier 1 support within the mainstream environment and early intervention is absolutely critical to high quality alternative provision, and something we're a champion of and something that we're fully supportive of. The tier 2 part of the system is about refocusing what happens within an AP to be looking at short-term intervention placements, not looking at an AP as a destination, but looking at an AP as an intervention that young children and young people who might need a different type of support, a different type of intervention, could access that at a high quality alternative provision, but for a short-term piece of work, which would then lead them to being able to be successful back in a mainstream environment. And then the third tier, which will always be there, you know, we can't get away from that tier, you know, as much as we don't want young people being permanently excluded, unfortunately it will happen within a wider school system. So we need to provide for that, but we need to be providing a curriculum in that alternate provision that's not the same as what happens in a mainstream school. That hasn't worked for them. So we need to really understand what those young people need in order for those placements, for those young people who are there, that they transition very successfully to whatever provision that is coming to them next, whether it is another mainstream school to give them another chance at that environment, a specialist setting, or in the main, a post-16 destination that is successful and sticks. Thank you, Macy. So how do we do this at Olive Academies? The slide that is on the screen at the moment that you're looking at is a collage of photos that show you the curriculum that a young person, be it on a tier 1 outreach provision with Olive Academies through to tier 3, receive within our academies. The pictures on there are of our young people accessing different forms of the curriculum, and what we're trying to show there is that all our young people access a needs-led curriculum that's based on what that young person needs as they come into our AP. And the whole idea of that needs-led curriculum is this: to re-engage them in their learning, re-engage them within the school system. The second point that those photos are trying to show is that it's a therapeutic based curriculum, and that's linked to the re-engagement. It can't be more of the same. And then finally, and the part that Mark has touched on, is that standards within AP across traditionally, historically, and even to the, even now, is academic standards aren't high enough. And we're absolutely clear, although it's needs led, it's therapeutic based, it's about re-engagement, and there's a high vocational element to our curriculum. It always has high academic standards, and English, maths, and other traditional education subjects are taught in our academies to a high standard, and the young people come out with very, very successful outcomes. Thank you, Macy. Another, within the SEND and AP system, it's absolutely critical that re-engagement and attendance back into education is a key metric for what we do. For too long, attendance was kind of ignored within the AP sector, and we do, just like it states in the Green Paper and the Improvement Plan, a standard around attendance, and attendance at AP has to be a key measure and a key outcome, and it's something we're very proud of. The national average for young people in a PRU or AP setting for last year was 61.2%, and it's dropped this year as well. So there's some data on there that the first terms of this year, that attendance has dropped to 59.3. We're very proud at Olive that attendance and re-engagement is absolutely critical, and we think a reflection of our curriculum is in that attendance figure. And we, through the change programme and developing SEND and AP systems nationally, this target and this outcome and this focus on attendance is absolutely critical in order to re-engage young people into high quality inclusive education. And just the last bullet point on that slide is just worth noting that due to that work of improving attendance within our academies, we're one of only 2 specialist multi-academy trusts that have been asked to lead a DFE attendance hub. So we lead an attendance hub, which is a group of schools coming together to learn off each other in order to improve attendance. There are 23 other alternative provisions in that hub, and we share good practice and share what we do. And also there is now 2 mainstream schools within that hub also learning from the good practice that is being applied within the AP sector. But for a developing SEND and AP system within a local authority, we feel that this is an absolutely critical element of what we're trying to achieve. Thank you. Next slide, please, Macy. The final part I would like to touch on is, and it's absolutely critical for the topic of this discussion, which is developing that system, is that AP needs to be recommissioned. It needs to be refocused on outreach and preventative support for young people before they get to a point of crisis or they get to a point where they're being excluded and going into an AP. So over the course of the last 3 years, we've developed what's called the Olive Outreach model, which is a multi-strand program of support that's based around our curriculum model with a couple key aims. The first one is to prevent permanent exclusions, but it's also about designed to re-engage and build capacity within the school system about dealing with young people, working with and supporting children and people and their families to maintain their education in a mainstream environment. We've done that. Next slide, please, Macy. We've done this. This slide shows the Olive Outreach continuum, and it's a very simplified model version of our model. But essentially, the Olive Outreach model has 4 strands, and the idea behind this model is that it's needs-led and context-led. So we can use this model in many different environments depending on what our commissioner is looking for. So currently, this model is being deployed in 3 different LAs across 5 different projects. And that's all come from a standing start in the last 2 to 3 years. but it's the same model and it has the same principles and is based on the same curriculum. The first strand is about building capacity within the SEND and AP system. So working with our mainstream colleagues about working with young people and their families around interventions for children who might be displaying what's traditionally seen as naughty behaviours or poor behaviours, but actually is about an underdiagnosed need that needs looking at and unpicking, and then a curriculum model and a support model that supports those needs. The second strand is what you would call traditional outreach, which is going into mainstream schools, working with young people, their families, and colleagues in mainstream schools in a bit more of an intensive way to support young people to stay in their mainstream school. The third strand is an in-reach respite strand, which is becoming more and more popular across our partners, which is where we've worked with those young people on strands 1 and 2. They come and work with us part-time within our settings, and that allows us to try and really unpick the needs of that young person in a more, in a deep dive type of methodology, and that provides us with that idea that we can provide interventions that then go back into the mainstream school. And I'm conscious that I'm at time, but the final strand is just a strand that's not taken up too significantly, but one that we feel is very important, that it's about transitioning young people who actually get to that stage that might actually need full-time AP, but doing it without a permanent exclusion, doing it without the trauma that they are being failed by the mainstream school, or they feel a failure and they're being rejected. And we do that in a smooth environment, smooth and transition and organised way, in order for them to reach the AP and seeing it as a destination that is a positive one. And that's not just the child, that's also the family. And Pru and AP isn't being seen as a dumping ground, it's being seen as actually high quality provision that meets that child's needs. So that's everything from us. Back over to you, Amanda.
Amanda, can I just say before you just, and I'm really conscious of time, but there's some
course.
fantastic questions in the chat. So, I'm really happy if we can take those offline and come up with some responses if you think it would be helpful to share.
That would be incredibly helpful. Thank you so much, Mark. What I was going to do actually was, Macy Ray, can you put up that, because there's another poll for people, but what I was going to do is